Welcome to LPN London Pharmacist Network. My name is Micah. I'm the lead pharmacist and the lead tutor here at LPN. London Pharmacist Network is UK's most intensive revision platform for the GPhC assessment. We use a traditional, active, hands-on approach to ensure that our students succeed, which is why in the last couple of exams, our students have the highest pass rates in the UK. And I'm going to be supporting you over the next weeks and months to be able to succeed and pass the GPhC exam in flying colors. Now, we don't just stop at passing the exam. We also want you to be the best version of pharmacist that you can be. And so we're going to equip you with the right knowledge, the skills, the confidence using our experience and our knowledge. Okay, so we have two options for you. You can join the intensive calculations course, or you can join the combo course. So the combo course contains everything we have. So as the BNF chapters, OTC, MEP, the same intensive calculations, you get that on the combo course. You will also get other things like other related topics, clinical trials, all days, changing patients' behavior, and so on and so forth, as well as the progress test, the mock exams, the question bank. They're all included in the combo course. For the calculations course, is purely calculations. So if calculations is where you have difficulties, if that's your weakest area, you can just get the calculations course and use that to consolidate your learning. This is the most comprehensive and intensive calculations program for the GPhC exam. It contains 36 topics in total. And so what we've done, we've taken the 12 topics on the GPhC website and we've broken it down into subtopics and sub-examples. So any topic or any example of GPhC exam question in the exam, you're going to find it here on this particular program. There is no question. In the last exam, I think there was just one question that they haven't seen before, the students who start their exam from our platform. But I've incorporated that now into this platform. And so all the topics are included, whether it's infusion rates or mass molar, mass molecular weight, creatinine clearance, even the new ones like your oxygen therapy, breastfeeding mothers, for example, health economics, they are all included. Crayon questions, they are all included. There's no topic that we don't have on this platform for the GPhC exam. Hands-on, rated #1 on Trustpilot for calculations. And the reason is because I used to be a maths teacher back in 2008. I taught in Ealing Broadway for a couple of years, where I was teaching GCSE and A-level students mathematics. So I come with plenty of years of experience, plenty of years of skills. I've developed my own formula and my own skills, which I'm going to pass on to you. I'm going to use those to support you, to teach you, to encourage you, and equip you with all you need to be able to smash this exam. It's all about being able to smash this exam at the end of the day. All of our students have done it today. I went out with the students who were successful after the June exam, and we went to Nando's and we had a fantastic time. And so I want that to be you. When you pass your exam, we're all going to go to Nando's and we're going to have a lovely Nando's meal. Okay, with our clinicals, we have a new intensive clinical program starting from the 10th of August. Guys, just so you know, the GPhC have made some changes to the clinical aspect of the GPhC exam, actually to both papers, but let's focus on the clinicals for a second. So when you see the GPhC exam now, you'll notice there's increased focus on your clinical decision making, increased focus on your application of knowledge, increased focus on your clinical aptitude. You have to be able to demonstrate that you understand the rationale behind decision making, and you have to be able to deal with clinical scenarios where patients are taking multiple medicines. Some of them are taking 7, 8, 9, 10 medicines. Some of them have multiple health conditions, underlying conditions. We have to be able to answer questions when you're presented with clinical scenarios like this. Is incredibly important. They've also incorporated more questions from like GP settings or hospital settings, but I have all of those incorporated in this new intensive clinical program. So by using our notes, our lecture slides, our practice questions, our workbook questions, the mid-revision test that you have to attend. By the way, it's compulsory that you attend all the revision tests, including the mock exams. Your pass mark is 80% on this course. Your pass mark is 80. 60 is not good enough. 70 is not good enough. 79 is not good enough. It has to be 80 for all the tests you do, whether it's a past paper, from a Google Drive, anywhere, including this platform, your pass mark is 80%. So start aiming for 80% in everything you do. All right, you have two aspects of our intensive program. So you're going to be able to access our pre-recorded materials on our new platform called Study Space. So when I refer to Study Space, just know that I'm talking about our new platform, which is available from the 10th of August for all our members. So from the 10th of August, everyone is going to be able to have their own personal login details to be able to access our new platform called Study Space. So on the new platform, we have all the pre-recorded materials, all the videos that are pre-recorded are on there from the most recent course. And so you're able to watch some of these videos before the upcoming live session, which is the other part of our program. So we have the pre-recorded ones already saved on Study Space, but we also have live sessions every week on Thursdays and on Sundays. On Thursdays, we start at 7. On Sundays, we start at 5. Okay, so you're able to join those live sessions. They take about 3 hours or more on average, and you're going to be able to ask me questions. I'll ask you questions. You're going to be able to interact. But where you've seen some of the materials, or you've read, or you've gone over some of these videos beforehand, you'll be a lot sharper, you'll be a lot faster, you'll be a lot more accurate with your calculations, with your clinicals as well. Okay, so take advantage of this. Go over all of them and then join me during the live sessions so that we can completely smash this. Okay, guys, we don't want to slack. We don't want to wait around. This is a very disciplined program that is focused to get the best possible outcome out of you. So do join the live sessions for the test, the progress test, and the mock exams. You don't have a choice. You have to join to be able to have access to those. So join and take advantage, get involved, join the new wave of trainees that are now smashing it with LPN. All right, so let's show you the new platform. The new platform is available from the 10th of August, like I said, and everyone will be able to access that new platform from the 10th. All right, so let's have a quick All right, let's have a quick look at this. All right, so this is the new platform. Guys, when you join, you're going to have your own username, which is normally your email address, and you'll be sent a link to generate your own personal password, and you're the only person that will know that password. Yes, so click on login, and you're going to put your email address on, and then generate your password, which I'll explain to you how to do that later on our members group. But yeah, so you create your own password. I've already done mine, so I'm just going to put mine in. Okay, so once you've done that, it brings you over to this page here. And so on this page, you'll be able to access either the combo course or the calculations course, which is underneath. Okay, so if you go scroll up, you'll be able to see the calculations course, and you can click enter to enter the calculations course. Now, some of our members are just on the calculations course by itself. And so if you're on the calculations course by itself, it will only give you access to this. Yes, it won't give you access to the combo course. So the calculations course only contains all the calculation materials, all the calculation workbooks, all the calculation webinars, the progress test, and so on and so forth will be on the calculations course page. However, if you're just on the calculations course page, you won't be able to have access to the combo course, which is this one here. And so the combo course contains all the BNF chapters, chapter 1 to 16, or the MEP content, or the OTC content, as well as the same calculations content that we have on the calculations course. Does that make sense? So it's everything that we offer in one place. That's what we have on the combo course. All our notes are concise. All our notes are straight to the point. All our notes are very direct. So you're not going to be spending hours and hours and hours going over notes and guidelines and slides. a lot of it, if you speak to the trainees that have passed, most of them scored 100 or more in clinicals, and in calculations, they scored 30s or more. Okay, so speak to any of them, go on Trustpilot, look us up, and this is what they use. They use this concise, straight to the point notes because it contains everything you need, all the important things you need to be able to pass this exam. It offers the fundamental, the basic information, as well as your ability to apply your knowledge. So we're going to give you access to this from the 10th of August. You can use that to learn all your basics in advance, and then during the live sessions, you'll be able to demonstrate your knowledge application skills. You're not able to demonstrate your decision making. You can ask me questions. I can ask you questions, and I can check that you have the correct rationale behind your decision making. So once we click, we have access to study space for combo course members, and it has all the chapters, as you can see, literally chapter 1, chapter 2, chapter 3, chapter 4. Some of the chapters are combined, as you can see. 8 and 10 have been combined in the video. Low weighted chapters have been combined. Everything is concise, straight to the point. You'll be able to pass extremely well using this in optimal time as well. Start as quickly as possible. You'll be able to pass using these materials. OTC, MEP, is all on here. The progress test won't be on here yet because we haven't done the progress test yet. According to our timetable, you'll be able to access the progress test when they are due. But once we've done the progress test, after 48 hours, we're able to put those things on here for you to watch. So with all these videos, you're able to watch them before the sessions, and then after the sessions, the live sessions, 48 hours later, we're going to put the new ones on to replace the ones from the last course. Does that make sense? So that's what we're going to be doing. Calculations is exactly the same things. You can log on, basically just click any of them, and you'll have access, right? So I'll give you a password to put in that will give you access to this. And it will be the same password for all the calculations. All the calculation sessions will have the same password to log on to Zoom, and all the clinicals will have a different password that will work for all the clinicals. So all the clinicals have their password for all the clinical sessions, and all the calculations have the same password you can use for all the calculations. I hope that makes sense. When you go to the bottom, you can access the slides and the workbooks as well. So just give you a few seconds to load. Yes, all loaded up. Have a quick look. Everything is here. Yes, you can practice beforehand. Do as many as possible. The videos are there for you to watch as well. You can do this. Is going to help you save time. This is going to improve your confidence because you've seen some of these things before. The questions on the actual live sessions may not be exactly the same, but the formulas, the steps will be the same sort of thing. So you're going to be ahead if you use this platform as I'm telling you to do. So yes, everything is on here, guys. Make the most out of this platform. The workbooks have been uploaded for you. You can have a look. 48 hours after our sessions, the new sessions, we're going to replace these old ones with the new ones, and so on and so forth. So you're able to come back and watch and use these materials as much as you want to. Okay, so it's all here for you. Literally, anytime you want to come on here and watch, you're free. You're more than free to do so. Happy one. I'm happy to see you. We're going to be covering calculation topics today, and I can't wait. Honestly, I'm really excited. Guys, if you've seen, well, some of you have seen me before, but if today's your first time of seeing me, my name is Micah. I've been a pharmacist for 10 years. So this year is going to make it 10 years I've been a pharmacist. But before I went to Kingston Uni to study pharmacy, I actually worked as a maths teacher. Okay, so if you know anyone who has done everything to ensure that we're ready. Okay, so guys, as you can see, you're able to access all the materials here. Everything is literally on here, and you're able to watch the videos. You're able to practice with the workbooks and so on and so forth. And this is going to put you in the best possible place beforehand. Okay, so anything you need to access is all on this particular platform. But remember, this is just one aspect of our revision program. You're going to be able to join the live sessions, which is where you can actually demonstrate in real time that you're confident and you're up to date with all of these materials. When you click on your profile, you'll be able to upload your picture. So you can upload your picture here. You can update your name, update your email, change your password, and so on and so forth. You can do all those things here. When you click on account, it gives you a billing address, which you can, this is our address, LPN address, but you can change, you can make editing to this particular, in this particular session. For your plan, it tells you, as you can see, when your plan is scheduled to end. And if you're on the November course, it will tell you when your plan is going to end. If you're on the June 2026 course, it also tells you when your plan is going to end. So it's all on here on your profile. You can click on your profile to see some of those details. Okay, so guys, everything is on here. This is available from the 10th of August. You'll be told exactly how to register. I'll send you a link and you're going to be able to join. Okay, so remember on Thursdays at 5 p.m. So on Thursdays at 7 p.m. and on Sundays at 5 p.m. using our live timetable. We have a live timetable. If you don't have that timetable, let me know. I'll send you the timetable. Using our live timetable, you're able to access all of this. Okay. So guys, please work incredibly hard. The last cohort did really well in the June exam. They passed flying colors. I want you to do exactly the same thing. So start working hard. Join the live sessions, interact, go over the workbooks, work as hard as possible to make sure we smash this exam. I believe that using the support I'll give you, using the guidance I'll give you, and with your cooperation, we're going to be able to smash this exam. That is what we want. You're going to smash this exam, pass in flying colors, but also be the best version of pharmacist that you can be, gain onto that GPhC register. I'm going to end this session now. Get in touch with myself if you have any questions. If you have any queries, you can send us an email, info@londonpharmacistnetwork.co.uk. That's info@londonpharmacistnetwork.co.uk. Get in touch if you have any questions, if you have any impediments, and I'll be able to sort all of those out for you. Thank you so much for watching. See you next time.